Thank you everyone for joining us for our Data to Action webinar on combining qualitative and quantitative data to advance equity in immigrants. And as people are joining, I'm going to turn it over to, I'm Kathleen Zegda, I'm with the Public Health Institute of Western Massachusetts, and I'm going to turn it over to my colleague, McCain Scharf from the Mass Department of Public Health.
Good afternoon, everyone. Thanks for being here. As Kathleen said, my name is McCain Scharf. I am an epidemiologist with the Community Health Equity Initiative at DPH. And we are so happy to have all of you here today. Given the times, we thought an interest that we have been hearing. We wanted to focus a little bit on immigrant communities in particular. And we're going to pull from the expertise of our partners who work with these communities or have been working with them to talk about combining qualitative and quantitative data. And we'll use our CHEI qualitative project with the um, Tufts Interdisciplinary Evaluation Research um, team to talk about how we do that here at CHEI. Next slide. So looks like people are starting to do this in the chat, but if you would please share your name, organization, and pronouns in the chat so we know who's here with us today. So later, after we have our presentations, we will break out into small groups as we have been doing and want to give folks an opportunity to meet with people who work in similar areas. So if you would click on the link that is hard, it's hard, I think, because people are introducing themselves, but Rebecca, maybe if you could keep posting the link. So it's a Mentimeter, and it will ask you to select which communities you work with. And you can always select general community members at the bottom. And if your community isn't represented, you can put that in the chat and we'll capture that too. Recognizing that you work with multiple communities as well. So you can select multiple or you can select the one you're hoping to talk about with folks today. Looks like we've gotten some good responses in. They're still trickling. So if you haven't had a chance, there's Rebecca Hunt has posted the link to the Mentimeter. Doing it again. Okay. So not surprisingly, it looks like the majority of folks selected immigrant communities, but also people whose primary English is not primary language is not English, and parents of caregivers and people of color. Oh, and youth and young adults. So definitely here, and we'll work on getting you into breakout groups with folks who work with similar communities. Next slide, please. She's trying.
Yeah, I'm trying to do this. There we go.
Okay, so just briefly, our agenda for today. I will do an overview of the Community Health Equity Survey and our Data to Action framework. And then we will hear from two of our partners, TIER and the Immigrants Assistance Center, about their work combining qualitative and quantitative data to advance equity for immigrants. And after that, we will have a breakout discussion and reflect on what we heard and ways that you might be able to use CHES or other data in combination with qualitative data. And we'll do a quick wrap up and have some resources at the end. So just a quick overview of the Community Health Equity Initiative. We collect data on health, economic, and community conditions in Massachusetts with a focus on residents who experience health inequities. We have two primary data sources, quantitative data from the Community Health Equity Survey, or CHES, and qualitative data collected by community evaluators working with the Tufts Interdisciplinary Evaluation Research Team, or TIER. The purpose of CHEI is to collaborate with community, state, and local partners, all of you, in using data to drive funding, programming, and policy change to advance health equity. Next slide. So a little bit more about our 2023 Community Health Equity Survey. It was developed by DPH in partnership with over 100 partners, both community partners and DPH partners. Data was collected mostly online from August to November of 2023 and available in 11 written languages and ASL. It was open to Massachusetts residents, 14 and under. Sample goals were set for communities of focus to ensure representation and sample sizes for the analyses we wanted to do. And over 18,000 Massachusetts residents responded to the survey. Here are our communities of focus. Again, we center communities that are often underrepresented in data systems and also most impacted by health inequities. The communities are listed here and also reflects the groups that we had earlier in the Mentimeter. And here are our survey topics. We collected information on demographics, safety and social context, substance use, mental health, employment, access to healthcare, basic needs, education, information sources, COVID-19 experiences, and neighborhood. And all of these data are available to all of you. This is a framework that was developed by the Public Health Institute of Western Mass and illustrates the data and action framework. We really want the data to be used to inform action and center equity, community voice, and power sharing in the center of all of that work in that red gear. And then these gears represent sort of a cyclical, circular process. We tend to start with defining what we want to do, using data to analyze and interpret the findings, prioritize based on those findings, then act, and evaluate. But again, it's a circular process. It's not always, clearly that way. But the goal is to move in a positive direction towards health equity for people in Massachusetts. So I'm
Okay,
going to pass it over. Sorry, go ahead.
thanks, McCain. So now we're going to have the opportunity to hear from several speakers about their experience with combining CHES data and qualitative data to advance equity for immigrants. So first, we're going to hear from the Tufts Interdisciplinary Evaluation Research Group, which is we'll refer to as TIER. And we have Emma Posner, Michelle Thompson, and Marley Pereda who are here. And then we will hear from Helena DaSilva Hughes from the Immigrant Assistance Center. And after they've all had a chance to speak, we will have a question and answer session. So people should feel free to drop your questions in the chat as they're speaking, and then we'll have an opportunity for them to respond after. So I will now turn it over to Emma, Michelle, and Marley.
Thank you, Kathleen. So, hi everyone. My name is Emma, and I'm joined today by my colleagues Marley and Michelle, who you'll hear from in a bit. We'll be presenting a mixed methods spotlight on language access on Cape Cod among residents who are immigrants. Michelle and I both work at Tufts Interdisciplinary Evaluation Research, or TIER, and our colleague Marley works with us at TIER and also wears many different hats. So before we jump in, we just want to give Marley a chance to introduce herself since she'll be sharing some of the work that she led on Cape Cod. Go ahead, Marley.
Hello, everyone. I am Marley Pereda, a social worker and community development professional based in Cape Cod, currently working at Cape Cod Children's Place. And I am personally and professionally passionate about having this great opportunity since last year to join the TIERS team to engage several community service providers with the goal of understanding some challenges that this immigrants community face when seeking support for their families. Thank you, Michelle and Emma.
Thanks, Marley. So as McCain mentioned, CHEI includes two data sources. So the first is the statewide survey that McCain mentioned was administered in summer 2023 that gathered information on residents' most pressing needs. And second, a community-led qualitative data collection project, which was led by our team at TIER. This project included interviews and focus groups with residents to understand their experiences and supports available to them and other topics that are difficult to assess through surveys. These interviews and focus groups were led by a team of community evaluators, like Marley, who are residents in a wide range of communities and bring a wide range of lived experiences across the state. Each of our 6 community evaluators bring personal and professional experiences and relationships within the communities they engaged through their interviews and focus groups. They received training and mentorship from our team at TIER to support them through the qualitative data collection and analysis process. Next slide, please. As part of our work, we created a series of mixed methods spotlights. These spotlights bring together the CHEI quantitative data, the survey data, with the qualitative data through the community-led qualitative data collection that our community evaluators collected during their interviews and focus groups. By looking at these data together, we can add context and nuance that isn't possible to see by looking at either data source alone, and can identify patterns that help us better understand the experiences of residents in particular groups. For example, qualitative data can tell us about patterns or experiences that may be different or not showing up from what we're seeing in survey data. Qualitative data could also help affirm what's showing up or what's seen in survey data. So we'll see some of those examples today. Today, we'll focus on the experiences of adults who are immigrants. And you can see on the right-hand side the list of other mixed methods spotlights we're developing. And these include for older adults, for parents, and youth experiencing housing instability. And all of our spotlights will be available on the CHEI website in the coming months. I'll pass it to Michelle.
All right, thanks, Emma. So like Emma mentioned, today we're going to be presenting findings from both the CHEI survey and from our focus groups. And the data from the survey represents 2,468 respondents who are residents of Cape Cod and the islands. And then we zoom in to highlight the experiences of 209 survey respondents who are Cape Cod and Island residents who were not born in the United States and speak a language other than English. The qualitative data you'll see was taken from 4 in-person focus groups that included 42 Cape Cod residents who are immigrants and spoke Spanish or Portuguese. Additional demographic information about the focus group participants is shown on the slide. And I know I went through our methods and sample really quickly, but for more information, we'll have a report coming out this summer. So we're going to jump into findings next. In the full version of this mixed method spotlight, we present data to highlight the experiences of residents who are immigrants on Cape Cod and the islands that focuses on 3 aims. 1, their experiences meeting their basic needs. 2, the barriers they encounter when accessing benefits, resources, and services. And 3, the types of supports they have and need. In the interest of time today, we'll just be looking at that second aim that focuses on barriers. And as we talk through aim 2, I'll be presenting our survey findings, and then Marley will present our focus group findings. So we'll get into it. So using the survey data, we looked at how residents who are immigrants on Cape Cod and the islands were accessing benefits. Overall, 16% of Cape Cod and Islands residents reported applying for or receiving benefits. And then when we zoomed in, we found that 29% of Cape Cod and Islands residents who were born outside the US and spoke a language other than English reported applying for or receiving benefits. So they reported applying for or receiving benefits more often than Cape Cod and Islands residents overall. I'll pass it to Marley to talk about what we heard about this in the focus groups.
Thank you, Michelle. We saw the last slide that Cape Cod residents born outside of the United States who speak a language other than English were more likely to report applying for or receiving benefits. But in the focus group, we hear that many describe its way that the language barriers affected their access into service and their ability to navigate health and social service system. One very focused group participation identified in some schools is that documents are either or not translated in ways that were easy to understand, such as the individualized education plans or IEPs, making it for sure challenging to understand those plans of service. A second identified barrier is limited information and service offering in Spanish or Portuguese. Some service, in particular related to mental health service, are very restricted due to the lack of bilingual health care providers, thus impacting for sure the quality of care. So this quote, translated from Portuguese, reflect this barrier. There are no Brazilian psychologists at the ABA office. My therapist is a sweetheart, a lovely person, but she speaks English only. So we have a language barrier because it must be translated, you know? So there are many things you want to talk about, but you have to wait for the translation, and then you end up forgetting. And the third barrier participants face is the shortage of interpretation service at different settings, such as pharmacies when pick them up medication, or at school meetings, or when they're starting process to obtain a driver license. This quote, translated from Spanish, illustrates well this barrier. I would love to go to the school meetings, but I don't go because I feel they're, like, as Puerto Rican says, like I am in a chicken dance. We don't speak English and they don't know anything. There is no translator. Another thing, hospitals, there is only English and Portuguese. There are not Spanish translations in the hospital machines.
Thanks, Marley. So next we wanted to learn about barriers residents faced related to discrimination. And so first we found that Cape Cod and Islands residents overall and Cape Cod and Islands residents born outside the US who spoke a language other than English reported ever experiencing discrimination at similar rates. About half of each group reported ever experiencing discrimination. However, though they experienced similar rates of discrimination, they attributed the discrimination they faced to different identities and experiences. So we can see in the bar chart that Cape Cod and Islands residents who were born outside the US and spoke a language other than English, shown by the green bars, were more likely to report experiencing discrimination related to their country of origin, language or accent, or race and ethnicity than Cape Cod and Islands residents overall, who are shown by the blue bars. Again, I'll pass it back to Marley to share what we heard about this during the focus groups.
Mhm. Thanks, Michelle.
Mhm.
Findings regarding discrimination. So, like surveys responded, our focus group participants experiences discrimination and bias and were able to tell us about how this show up for them when accessing service. For example, some share a sense of being discriminated against and prejudiced when seeking resources and service. This quote, translated from Portuguese, detailed discriminatory practices. Were there moments of racism, discrimination for being Brazilian or for not speaking English? There were, there is no denying on that. There was a time when I needed to mail a document, and I think I am going to die remembering that man face at the post office. He was wonderful, stupid to me. And I left there crying and promising to myself that it will be the last time this happened, and no one will make me go through this again. One, because I don't deserve it, and two, because I don't allow it, and three, because I will learn English. Some participants also turn away from service and ask to return later with their interpreters, such as at the pharmacy service or at the driver license exam. This quote, translated from Spanish, illustrates well this experience. The day they went to change their driver license, that day the guardian at the entry treated them like a garbage. I have to go there myself and make a formal complaint because you go with your appointment and all the documents and they don't even let you in. You are not welcome here because you don't speak English. If you don't speak my language, you can go, you can go. So now we will review the summary and recommendations based on our studies. So it's a quick summary of the findings I just shared. Residents born outside of the United States who speak language other than English were more likely to report challenges accessing benefits, which could be related to their immigration status. Focus group participants share examples of language barriers and experiences of bias and discrimination that affect their experiences accessing service. Now, I would like to share a few recommendations that came from this work. The first one is improving access to existing resources. The need to increase bilingual navigators across different service and outreach process. It's necessary. The second recommendation is support language and settlement goals. How? By increasing English language learning opportunities and facilitating the transfer process of professional credential. And the third one is continue to prioritize language access. Different approaches such as funding for translation or interpretation, ensuring translation information across literacy levels, and access to fair interpretation service in various service contexts. Build a focus on language and cultural sensitivity into organizational practices. How? By receiving training in translation and interpretation service and seeking further communications methods to reduce the language barriers with clients. As we mentioned at the beginning, what we share today reflects this is just a small portion of our work on this topic. We will be sharing our findings and recommendations related to basic needs and support on the CHEI website in the coming months. Thank you.
Thank
Thank you.
you so much,
Well,
Marley. Oh, Emma, I'm sorry.
That's okay. Thank you so much, Marley. That was wonderful, Michelle. So, as we mentioned, our team is putting together several products. So this mixed methods spotlight, this is just a subset of one of the spotlights, and they'll all be available on the CHEI website this coming in the coming months. We do want to acknowledge the many folks who were collaborated with us on these spotlights. You can see on the right-hand side. We'll also be sharing qualitative summary reports and a cross-cutting qualitative report. So these reports will share just the qualitative findings, both from specific communities of focus, as well as looking across communities of focus. So stay tuned, and thank you all so much for the opportunity to share this work.
Great. Thank you so much, Emma, Marley, and Michelle. And really wonderful to see the combination of the quantitative and qualitative and thinking with a data to action framework with recommendations as well. So now we're going to turn it to Helena DaSilva Hughes from the Immigrant Assistance Center to share how they've been using CHEI data and data for work to advance immigrant equity.
First of all, I'm very excited to share our work with the Community Health Equity Initiative. Our efforts always focuses on using data-driven storytelling to illuminate the experience of our immigrant communities. We use the data to identify disparities and trends affecting immigrant populations, combined with quantitative insights and lived experience to create compelling narratives. By centering our stories in both evidence and empathy, we're building a powerful platform for advocacy, education, and systems change. Health disparities amongst immigrants in the United States are well documented and multi-faced, influenced by factors such as immigration status, language and cultural barriers, social economics conditions, and systemic inequities. For example, healthcare coverage of uninsured rates as of 2023, approximately 50% of likely undocumented immigrants, adults, and 18% of lawful present immigrants, adults, are uninsured, compared to 60% of naturalized citizens and 8% of US-born citizens. An example of how we utilize stories. So first of all, I want to say we service about 14,000 clients. They come from 48 different countries. All of our staff are all immigrants, including myself. We're from Portugal. We're from Central America. We're from South America. So we really represent the immigrant population that we serve. A lot of our immigrants, where we provide direct services. So it's very easy for us to get these compelling stories because they come right from the immigrants that we serve. So it's really, really important. An example of several, for example, lots of our clients live on mixed immigration status which basically they have no health insurance. So many times when they go to seek help, they go to the hospitals, and many times their prognosis are fatal because they don't have health insurance. And so we utilize some of those stories from our clients as we're putting proposals together, to utilize not only the data, but the storytelling of our clients that we have here. Another stories that we utilize quite a bit is the mental health and trauma. So the IAC, we have the Immigrants Assistance Center. We have this project that we created back in 2008 that works with the unaccompanied youth that are coming through the border. So these students have been abandoned by at least one parent, are fleeing from violence in their country, and the voyage to the United States has been extremely difficult on their journey to the US, and many have been abused. So these students have limited mass health, which does not cover mental health. So the IAC, the Immigrants Assistance Center, intentionally hired a mental health therapist from Nicaragua to provide therapies to these students, which I think previous presenters mentioned the fact that it has to be culturally appropriate mental health. And so it was very difficult for us to find a mental health. I think we are the only one who has a mental health therapist from Nicaragua who are working directly with these unaccompanied youth. So we hired this person. We basically had to raise money to pay for her because a lot of our children don't have mental health. And so we are very intentionally in a lot of the work that we do. We also work very closely with our elderly population And we did the same with them, hired a therapist who is Portuguese, who understands the culture and the language. Because a lot of times, if you're providing therapy and you should not be utilizing translators or community health workers to do this type of work. So it's really very intentionally that work that we are doing and utilizing the data to do these and storytelling to speak about the communities. It is extremely important that as service providers that work with the immigrant population, that we do not forget the culture of the immigrant population that we serve. So we are utilizing, we've always done the data and the storytelling. We've also have used, especially now under this present administration, more than ever, we need to utilize the data and the storytelling of our immigrant community. So we also have done a Did You Know campaign that we did back in 2016, and we're basically utilizing data to talk about the contributions of the immigrants into the U.S. economy. For example, 54.5% of immigrants in Massachusetts have become U.S. citizens, which means now they are voting. So it's important for the general population, especially our legislators, to understand that. For 78% of immigrants in Massachusetts are authorized residents. And so that's really important. So we utilize this campaign to really drive the information to the general population. And basically, immigrants have 79.1 rate of the workforce participation in Massachusetts. So it is really, really important that the data and the stories, we create compelling stories, and it is really, really powerful. And I think as having an agency that is driven by immigrants, was founded by immigrants, and we basically look like the immigrant population that we serve, and having 14,000 immigrants in our database from 48 different countries, these statistics are really important as we look at funding sources. So I don't know if anybody has any questions, but this is how we do this work here at the Immigrants Assistance Center. And more than ever, funding is always a challenge. And I think it's going to be even more challenging as for the next 3 years, or it seems like 10 years, but that's another topic.
Yeah. Thank you so much for sharing, Helena, and for sharing how you all are thinking about combining the quantitative data and the stories to help you in your really important work to support immigrants and immigrant equity. So now I'd like to open it up to questions for either Helena and the Immigrants Assistance Center or to the tier team. So who spoke about the spotlight that they were working on. And you can feel free to drop it in the chat or I can start while we're waiting to see. For the tier team, I'm wondering, so you really have done a lot of work to think about both the community health equity survey data and then also the qualitative data. And so I guess in thinking about bringing those things together, I believe you all do that as a group or in some form. Can you share a little more about that, about how you make meaning of the data as you're doing it, interpreting it?
That question is for who?
For anyone on your team.
Well, I think I think we work because we're a small team, so we all work together, right? So we have our case managers, we have the therapists, and then of course, we got the grant writers. I have been working with the immigrant population for 41 years. I've been here for 41 years, so I have a lot of experience. I've started as a secretary and I moved up to president. So to me, I think these lived experiences that we have as immigrants, right? We have immigrant staff from Nicaragua, we have staff from Portugal, Peru, Venezuela, Guatemala, Dominican Republic, Peru. So we're Argentina. So we actually really the Azores in the islands, Brazil. So our staff comes with so much experience themselves, right? So
Right.
I think
Yeah.
as we work as a team, right? So even though we all have different, when it comes to we get all of information together, and our clients basically they look at us as part of their family, so they open up. We know more about what is happening to them than their actual families.
Yeah.
So that information we document. So as we're putting these compelling stories, we are working as a team and we are gathering their stories because more than ever, the narratives are so, so important.
Thank you. Thanks so much for sharing, Helena. And Emma, Marley, and Michelle as well.
I'm happy, Marley and Michelle, unless you have a burning idea here, I'm happy to jump in. So on our end, what we did was Marley led the qualitative data collection and analysis on Cape Cod. Those data were analyzed thematically, and there's more information on our methods in our reports. And then what we did is we submitted data requests from your team at Public Health Institute of Western Mass, and we looked at kind of some key areas of overlap. So topics that were, for example, barriers that you heard today. We looked at barriers that came up in the survey in terms of accessing services, and then together looked with Marley at those barriers to think, okay, well, what surprises us based on what came up in the survey? Are there barriers that are there places where we're seeing barriers based on survey data that we didn't see barriers in qualitative data? Or is the survey data affirming the qualitative data? So we kind of looked at the survey findings and had some guiding questions that we used to kind of think through the different ways that the qualitative and survey data were shining light on experiences of residents in more nuanced ways. And Marley and
Wonderful.
Michelle, you have anything?
Great. Thank you so much for sharing. So we are at time and we're going to move into our breakouts. And again, want to thank you, Helena and Emma, Marley, and Michelle for sharing about the work that you're doing. It's so important during this time in particular and in general. So now I'm going to turn it over to my colleague, Barry Keppert at MAPC to move us into breakouts.
Thanks, Kathleen, too. Thanks everybody for being here, for listening to those. And we talked about experiences of kind of exploratory and learning by data and conversations to kind of the way a digital campaign can bring in data and be connected to stories. So want to give everybody a chance to kind of connect with one another since we're all here. We're dropping two questions in the chat that you can use as prompts as you move into small groups, but really it's just a chance for you to connect, meet someone new who's in this space potentially, but also kind of share your experience in the same way. What is it about data? What is it about stories? And if you want to think about the Community Health Equity Survey, where could that potentially be helpful to you too? So Isabella has been working her magic in the background, and I think you're going to see it pop up soon to join a breakout. We'll be there for about 10 minutes or so, and then we'll come back. We just want to leave you with some parting notes and resources. You have a kind of shared experience or something in common, or potentially even kind of learn from one another about some work that could be helpful. And there's fewer of us now than there was at the beginning, so thanks for sticking with us till we get to this final moment. We're just going to wrap up the session so we can get you out by 2 as we promised to. But I think we want to highlight some resources before we jump off too. So I think, am I bringing this home, Kathleen and Isabel? Just want to make sure I'm okay. Awesome. We'll get the slides back up. So here's a reminder where you can find information about the Community Health Equity Initiative too. You see the website there on the right. It's a really wonderful site if you haven't visited it too, because it has resources around how you can come at the information and potentially share it, where you can get the data, and there's lots of ways to get the data directly from the website. And then when it comes to data and action resources, I want to highlight Kathleen and Rebecca, myself and Tanaya, who are here. There's really wonderful resources in addition to the folks like Isabella and McCain at VPH to be able to help with this data too. And so we stand ready to do that as part of all that too. So please give it a chance to check it out because we think it's really helpful information and really represents unique data from across the Commonwealth too. You'll also see featured in the lower left a link, and this will be part of the slides that do come your way and that are also in the chat now. But if you were to click on that link, you'll find on there a listing of a number of resources, both statewide but local, that may be of interest to you as part of it too. And if for some reason you see something missing and you think it's important to be on there, please email Isabella. Please let us know and we'll get that added to the list because we know there's a lot of wonderful resources that people have been putting out there and developing really to support our neighbors, our residents, the folks who live here as part of the Commonwealth too. So we'll go to the next slide. Often we'll do office hours, so look for a follow-up where we may ask the question of essentially if you're interested in having further conversation about this, particularly kind of the data and storytelling connection of it. And then lastly, these sessions continue to try to improve and be more useful to everyone through the feedback we receive. So we'll send it out as follow-up, but if you'd like to take a survey and offer us some of your feedback as it's top of mind, we would welcome that. Just going to give a shout of appreciation to Rob and Lucy, who are here as our ASL today. And thank you all for sticking with us here to the end. Hopefully you're taking away something you can use or share with another. But thank you for being here and being part of this work.